trying to think of the best way of dealing with this. Would it be possible if you just email me to tell me that you won't be attending the hearing and that you acknowledge the correspondence or something of that nature? Do you understand what I mean? So at least I can say, listen, please stop bothering him. He doesn't want to participate in these proceedings. I'm just trying to kind of be as fair to you as possible, as much as, and I understand your frustration about the process. What would be your idea?
I made it very clear. What your General Medical Council is doing is unethical. Is not something which I can accept. Okay, so you have raised allegations against me using one of your stooges because that man knew exactly what I am doing, why I am doing it, and he does not want to accept it. He is the chief of NHS in NHS 111 in Oxford, okay? Initially, he said he didn't want to take me because I don't have hepatitis B. Then for some reason, he called me after 3 or 4 months later. So it is basically he's done it purposely to discredit me because he is defending himself. I don't think General Medical Council has seen exactly what he is doing, why he is doing it, and you are making allegations which I really don't care. Because if I say I'm not coming in, that means you say I've accepted your proposal. I am totally ignoring it. As far as I'm concerned, General Medical Council is nothing for me. General Medical Council is not an institution which I trust because you have concealed the truth and harassed me before. And then afterwards, now you're doing it again. You are defending your institution. I have asked a simple question a long time ago to define doctor. You understand? And you have actually, your General Medical Council has destroyed my... They came here, didn't pass PLAB, they had to go back to India and they committed suicide. Your institution has harassed doctors, and I will not accept your institution as anybody whom I respect. Okay? Please, leave me alone. I don't care what you want to do. I have not killed anybody. I have not harmed anyone. So why are you harassing me?
Sure. Honestly, to be honest, Dr. Srivatsa, I'd love to leave you alone insofar as that's concerned. I do understand your position. Why don't you put in writing what you've just said to me now, that you don't acknowledge any of the allegations?
I have recorded this conversation, okay? I'm going to send it back to you because you better hear it because I am not going to sit and take it. Please, I am a defender of patient care. When I raised allegations, I did not make an allegation just out of the hat. I collected evidence. I presented the evidence in 2011. So instead of listening to what I said, the General Medical Council decided they're going to listen to Surrey PCT. Surrey PCT tried to harm me, and you did not defend me. I am a doctor who is defending my patients, and General Medical Council harassed me, afterwards imposed an IOP. That was not fair. You have destroyed my family, my home. I am living here alone like a hermit with no relatives, no family, no money, no support. Okay? And on the top of it, you are harassing me just like putting salt on a wound. Please, your institution has no right to harass doctors. I make it very clear because I have taken enough. And I am not scared. You can put me in jail, you can hang me, you can crucify me. But what your General Medical Council is doing is so stupid because the whole world is in turmoil. Everybody is scared. Your NHS 111 thinks that temperature is important. Please, I am a doctor of 40 years experience. I have taught students, I have taught medical students, I have taught doctors and nurses in Surrey PCT. And I say nurses cannot work like a doctor. I really mean it. I would rather die than being treated by a nurse practitioner. Please, you wake up and do something about it. The world is already been destroyed by unethical methods. You are living in a cuckoo land. And don't call me. I'm going to send this recording straight to you. Please present it to your whoever in the General Medical Council is. I really don't care. The world is coming to a turmoil and you're playing with a fire. I am really not going to take it anymore. I've had enough. All right, I'm sorry, Brian. This is not against you, okay? I am venting my frustration. I have patiently waited. Medical profession to wake up. Wake up. Pandemic was something which would have never happened if they had listened to me. I have made every attempt to prevent this problem. My articles tell it. My books tell that. And why can't General Medical Council wake up and listen to one doctor? Maybe I'm a little Indian who's not a professor, who doesn't have a Nobel Prize. I am a sincere, honest doctor who dedicated my 40 years of my life to help people, educate people, and make sure that our children are going to be safe. And you people have no idea what you're doing. You're just going by books. That's not medicine. Medicine is a branch where a doctor needs independence to do what he needs. How dare this doctor go and look at my records without my permission? What happened to Caldecott principle? A doctor has no right to look at my confidential document without my permission or the patient's permission. So you can't just raise a complaint just because the woman didn't like my accent, didn't like my face, or maybe didn't like because I didn't give her an antibiotic. You can't harass doctors for that. You have to wake up. I am sorry, Brian, this is nothing against you, okay? This is a General Medical Council I'm talking. I make it very clear. Yeah?
No, I understand.
You've been a lovely person, but your hands are also tied up. You are bound by this legal system.
I don't want to, listen, I'm conscious that you've been becoming upset, and I understand why you become upset about this, and I'm grateful for you taking my phone call. As I said, just with a view to sort of stop ringing you and I know that, and I'm just conscious. But you'll send me an email now, and if you could just say in the
I'll send you this. I've recorded this conversation so that the General Medical Council listens to what I'm saying. If they don't want to listen, let them go to hell. I don't care. But I'm going to send it to you. Okay?
I understand. If you ever do change your mind, you've got my number.
I am not going to change my mind. They'll have to drag me from here.
I know. As far as having contact with me or speaking to about situation, I'm more than happy to take a phone call. Send me an email. I will respond. I'm grateful for you taking the call to me this morning, and I look forward to hearing from you via an email later today.
Is the General Medical Council registrar involved in this?
So the General Medical Council, this is a fitness to practice allegation. If you send it, and we have obviously instructed an expert in relation to the allegations.
That's right. You are saying fitness to practice allegation. Is this a private agency who is running this business, or is the General Medical Council involved in this already?
The General Medical Council are involved in this.
So the General Medical Council registrar knows my case.
Sure.
Does he know or doesn't he know?
When you say the registrar, what do you mean by that?
Sorry, who's the head of General Medical Council? Does he know this?
Who's the head? The assistant? Yeah. No, sorry. I'm not sure if they know all about the cases.
Yeah, but he what do you mean? My case has been going on for almost 18 months or 2 years.
I know.
Do you mean to say he is not aware of this? Because because this is to do with medical ethics. So he should know that, don't you think?
Yeah. Well, we have a hierarchy in place here, as I say, with any kind of hospital or any sort of organisation in relation to it. And as to whether the person at the apex, at the top of that pyramid, for the want of a better term, Dr. Srivatsa, is absolutely aware of the ins and outs of every case, I can't answer that, and I don't want to mislead you. I've never misled you.
No, you haven't. So, now, why I'm asking this is because all the emails and letters I get is not from a doctor. It's from some layperson or somebody who's been hired to look at my records. It looks like the medical people haven't looked at any of my records. General Medical Council has used a general practitioner who is giving a report about me when I am a clinician from a hospital. So I have dealt with critical care and serious patients every day for 40 years. A general practitioner doesn't do what I did, okay? So I can look at you and tell you what's wrong with you. I don't even have to examine you. because that's what I did for 40 years. And instead of, that's why I'm asking, because a doctor with similar experience as me will understand what's right and what is wrong. You can't ask a plumber to talk about your profession. You understand? So that's what I'm saying. I'm a bit confused because it looks like doctors are not involved in this business. So I want to know whether the registrar of the General Medical Council, who may or may not be a doctor, knows and is aware of this situation. Because I am making serious allegations against General Medical Council to be racist because they have made us pass plab to work in UK, whereas the nurse who sat with me and observed as an observer is qualified to work as a doctor, the NHS 111. That is unethical. That's substandard care, I would say. So they should know that, don't you think?
No, I understand your position in relation to nurses. You've made that clear. Listen, Dr. Srivatsa, I wait to hear from you insofar as the email card. Thank you so much for responding to my email.
All right, thank you, Brian. I'm extremely sorry. Stay safe. Don't go to the nurses and get treated. Take care of your family.
And if you do send me an email just to say acknowledge that you won't be attending, and you don't acknowledge any of it, it's not an admission by you by not attending or by corresponding to me.
I'll make it very clear. I'm not participating because I don't think there is anything. I had already applied.
Any change of mind, any change of heart?
No, I'm not going to change my mind. They can say what they want. They can say what they want. I know myself. I know who I am. I know what I've done.
I want to make I just want to make myself as approachable as possible, Doctor.
You did. I have no complaint against you, but your hands are tied up, and you have to present it to your seniors.
Let you go because I have another telephone appointment.
All right.
Pending,
Thank you. Take care.
Bye.
Bye.
Bye now.